Well, welcome back. Again, we are here with Ozimba, the president of Alpha Home Health Agency. And Ozimba, thought maybe you'd tell us a bit about the services that Alpha offers.
Yes, so thank you. Alpha Home Health Agency is a Medicare certified home health agency. So that means we will provide home health services through that are approved by the Department of Medicare and Medicaid Services,
Okay.
CMS.
Yep.
And that's different from non-Medicare accredited agencies in the sense that we have to follow the provisions that are approved by CMS itself.
Oh, so you have to have the stuff. You have to have the goods.
We have to have all of it.
Okay,
Yes.
so that's a good thing that folks can know.
Right. So home health, we provide home health aide services.
Okay.
Right. And these are short-term services for individuals that might be coming home from a hospitalization. These services are usually shorter in length. So maybe an hour here to come assist somebody with a bath in the morning, or mostly those hands-on services for somebody that might have had surgery and you're not able to maybe do a few things on your own at any particular time of the day that you choose. We will have a certified home health aide come into the home to provide this service.
So literally, it's like normally I take a shower at 5 o'clock.
Right.
And I've got I need somebody here about 5 o'clock, and that can be arranged.
That could be arranged.
That's very convenient.
Yes.
It's very convenient.
Yes. And you have somebody that's certified by the state of Ohio as a state-tested nursing assistant to come in and provide this service. So you're getting a good quality service.
Good. Okay.
We also provide, I would talk about the Medicare services first. So we provide skilled nursing services. And these services are provided by a registered nurse or a licensed practical nurse, an LPN or an RN. And these services will include things like changing bandages for wound or wound care. It could be insulin, diabetic management. So providing insulin, checking your blood sugar levels at certain times of the day that are approved. It could be pain management. We have that service as well. So we have personal care service. That's a Medicaid service. The personal care services are the same thing as a home health aid under Medicare.
Okay.
It's just you call it differently. They just call it something,
okay. All right.
something else.
That's okay. That's just a kind of a legal government thing. Then,
Right.
Okay.
Right, exactly.
But that's good to know, just the distinction in case folks don't know.
Yes. The length of service is usually longer, because these are long-term care services. They are approved for longer terms, as opposed to Medicare that will only give you maybe 60 or short-term periods, and then you have to renew it. So most personal care services are usually provided through third-party companies, insurance companies like CareSource or United Healthcare or Buckeye. These are managed care companies, HMOs. And
now, does the individual have a say in who they're going to be working with?
Always.
Okay.
Yes,
all right.
always.
So this is something it's in your control.
Yes, always. So we always match your caregivers with you. We never send anybody into the home unless you actually get the opportunity to interview them, right? We've done our due diligence to hire them.
Yeah.
We make sure that before you start working with anybody, we send them into the home. You do a short interview, get to know them, talk to them and make sure that there's a nice connection too, especially for Medicaid services that you're going to be working with this individual for a long time. Make sure you're able to, you feel like there should be a level of trust there. You feel like there could be a connection with somebody like this. You have somebody coming into your home 6 hours a day, maybe 5 days a week for maybe, who knows, years. And that's the hope, is that you get to have the same individual working with you for a long time. And
you don't want them to feel like they're strangers.
Exactly.
So it's good to have that the relationship grows, huh?
Absolutely. Yes, you get to know them. And Yes, so there's always that opportunity for you to be able to interview your staff.
So, and that's good. I mean, you remember, you get to choose whom you're going to use,
Right.
and you get to, if you go with Alpha, you're going to get an opportunity to meet that person who's going to be helping you first, and that's
Absolutely. And if anywhere along that working relationship it's not working, we always say, let us know, and we can either find somebody else. The other thing too we always do is we have backups. In case your caregiver is not available to make it on a certain day, you have somebody else that's going to be able to come in and be a substitute for that, for that period.
Do you do weekends and holidays too?
Yes, we do. We will work on weekends and holidays. We are a 24/7 agency, so we are. You can reach us at any time of the day. We always have somebody on call after office hours. Our staff is willing to be flexible. And we do hire individuals that might want to work late nights or or work night shifts. So we were talking about Medicare services.
Yeah.
So we talked about the home health aide, and we talked about the skilled nurse. And we also provide therapy. So physical therapy, occupational therapy, speech therapy, and these services are provided by trained and certified therapists. All these individuals are, certified by the state boards in Ohio. So, you can come in, and if you want to know if your therapist is certified by the state, you can always look them up, or we can show you.
Well, that's great. That's great. And that's just confidence,
Yes.
And I think confidence is probably, I have to imagine it helps you feel better, really to your health. And
yes. We really always value high quality care. That's always the most important thing. Like we were talking about before.
Yeah.
I tell the staff, if you don't want to be in the home health care field, and you don't have the compassion to help somebody else, it's not the right field of work for you. So
that's a good philosophy, and that's we've talked about, and I know you when you were growing up, you took care of your family, and that's kind of something I think is ingrained in you right here, and imagine your staff too. And can you tell folks how best should they get in touch with you?
So if you would like to contact Alpha Home Health Agency, you can reach us by phone at area code 216-298-9041. Again, the number is area code 216-298-9041.
Thank you so much, Ozimba.
Thank you.